We are continuing a conversation that we started about his career, nursing. So today we are talking to nurses in Kenya. So if you're a nurse in Kenya, this is for you, or if you're an aspiring nurse in probably nursing school, this is for you. So in this conversation, we're going to talk about the process on how to come here as a nurse from Kenya to America. So here is someone in the field, and we are really going to borrow from you, Zeph. So welcome once again. So tell us what it takes to become a nurse from Kenya to here. So what do you need to do?
Okay, yeah, that's a good question, because so many people are writing to me and sending messages saying, hey, Zeph, I'm a nurse in Kenya and I would love to come and practice in US. So to practice in US, generally it requires the person to do what we call NCLEX.
NCLEX.
Yeah, so NCLEX exam is like a state board exam. There is no NCLEX for entire US. NCLEX is based on every state.
Okay.
So if you were in California, you're gonna do NCLEX board for California. Or you can do what they call compact states. Compact states are states that they work together. They agreed to work together in that compact states. So if you did your NCLEX exam in Arizona, then you can practice in New Mexico, you can practice in Iowa, you can practice in Kansas, you can practice in, I don't know Kansas, you can practice in Texas, and so many other states. There are so many, about over 20 states that are compact states.
Okay.
So the main idea we're discussing is doing NCLEX, which people normally go to South Africa, they can fly to India to do that exam. And once you do that exam, then you can look for hiring agency in US that can help you process your papers and everything.
Okay.
Yes.
So is this exam expensive? How much is it?
I wouldn't tell you exactly the price, because I don't know for sure how much it costs at the moment. But when I did exam, and this was in the United States, so it was about $200. I don't know when, if you are doing the same exam in Kenya, if they charge differently for people who are in Kenya because they are doing it in a different country. I do not know, but I believe it's not. I wouldn't expect them to be charging $500. That would be ridiculously high. I don't think so. But it's something that individual who is aspiring to do NCLEX exam can find out. Maybe Google, or see what they can do on testing centers, or people who have done it that way. They can also help them.
Okay.
But the most important thing is not how much, but the desire to do it.
Okay. So how much did you pay when you did yours, so that we can get like someone who's watching at least a little range, or probably how much?
It's probably gonna be misleading. Like I said, it was about 200, but I don't think
it's about $200. So that's
that
about
was them,
20,000 Kenyan shillings at least. That's the minimum.
And that's why I say if it's 500, it will be ridiculously high. I don't think it is.
Okay.
Yeah.
Thank you. So
but it's something to confirm.
Okay. So how is this NCLEX exam? Can you tell us like what type of questions, or what's the structure? How do you pass it? Yeah.
Yeah, so the thing is, if you went to school in Kenya, sometimes the way things are done in Kenya is done with the idea of passing the exam. That is not the same case with NCLEX. You can pass your NCLEX, you can pass your nursing school and fail to pass NCLEX exam. So it's so tricky. You need to really study the style of they call NCLEX testing style, because they test the critical thinking, how you can handle situations like, say, let's say if they bench of a cardiac arrest, what do you do as a nurse? Okay. Because this is something that is so
life and
death, and it's going to be an emergency. So you as a nurse, you need to take action to save this person, because if you don't do what you're supposed to do, then that person will die. So the NCLEX will bring questions in a way that tests your ability to address emergency situations or things that are, unusual, and address the problem. And the thing is, I can give you a good example.
Sure.
And I know I'm talking to nurses, so these are people who are already aware of what I'm talking about. Sure. Because if I talk using terms, you will understand what I mean, that any lay person can understand. Okay. So let's say you find a patient, the question can come that way. You find a patient, your patient has history of diabetes, and this patient is unconscious, diaphoretic. What are you gonna do as a nurse? And that's how the NCLEX is trying to find you.
Okay.
And then choices. So the exam would have choices. And then the choices would say, call the doctor, give the patient IV glucose, give the patient orange juice, do the finger stick.
To find out the numbers.
Now you will be thinking, now this requires your thinking. Because now what am I going to do? Can I call the doctor? The patient is unconscious, they are forensic. What am I going to do? So, and this person will catch you because you already know this patient has history of diabetes. So what you will do now is to do the assessment. You need to find the numbers. So you start with the assessment and then do the intervention. Okay. You cannot do intervention for what you don't know. What about if you are given sugar or whatever, the IV glucose, and the patient is not actually hypoglycemic? It probably something else that is making the patient unconscious. Yeah, so you need to do that assessment, and that is how they test you. They really try to see if you are capable of understanding what to do in an event. So another thing that can count in that same patient, they can test you, like say, hey, you find a patient, is there forensic? Blood sugar is 40, and those numbers are US numbers, not Kenyan numbers. So 40 is already hypoglycemic in US. And the patient is conscious. So their forensic conscious, blood sugar is 40. What are you gonna do? Do finger stick?
Those are the multiple choices.
Yeah, do finger stick, IV glucose, call the doctor, or give some orange juice. Very tricky. All answers are correct. But if you want to eliminate this, you're gonna say, hey, can I do IV glucose? No, the patient is yes, the patient is hypoglycemic, but he's conscious. The patient knows, can talk to you, is okay. So if he's conscious, then you can do oral sugar. So you see, that's how they catch you. You have to have knowledge, and you have to have the critical thinking part, which sometimes misses in our Kenyan system, because even in primary school, we don't teach our kids to have that critical thinking. We only want to know the answers and answer the answers correctly without really knowing why and how and what to do in eventful situations.
So it sounds like you're saying what they are looking for in this exam is it's not what you know, it's how you apply to what you know.
Exactly. So the application is the mother of all things. So for somebody who is in Kenya and wants to come and work in US and do everything, I'll tell you that do your assignment. Don't go and waste your maybe cold work. You're gonna spend a lot of money, because if you're gonna fly to India or fly to South Africa to do your NCLEX, then you have to study before doing that. Okay. And preparation for study is not the Kenyan style of passing the test. No cramming. It won't help you. You need to do the study. If you see an answer given and you see the answer is B, then you need to find the rationale.
Why did I say it is B?
Yes. Once you get that rationale, like I gave example about the hypoglycemia situation, you need to find out, why did I choose to do the finger stick? It is because I don't have the numbers. I don't know the numbers. I don't know for sure that this patient is hypoglycemic. So I need to confirm that before I do the intervention. Okay. And then for the second example that I gave, I would choose to give orange juice because this patient is conscious, so he can swallow, he can follow commands. And because the assessment has already been completed, so I know this patient is hypoglycemic.
Oh, wow. Okay.
Yeah. But if this patient was unconscious and is hypoglycemic, then I will do the IV glucose. Okay. So that's how
that's how NCLEX is.
Like, that's how NCLEX. I just gave an example. There are tons of them, like for every situation. Okay. Yeah.
So how many questions are there in this exam? And it sounds like you're saying the structure is multiple questions.
Yes.
And how many questions? How much time? do you
sometimes
have?
When it's crazy is when it is select all that apply. So you're not gonna choose one answer. You're gonna use maybe 5 of them.
And then you fail.
And they are so confusing that you can choose one wrong one and you wrong the entire question. So with NCLEX exam, they have I would say is about, if I still remember, I think they are about 300 questions. If it's not 160, I don't remember when. It has been a while. So, but this is how they test you. You don't have to do the entire questions.
Okay.
So you can do the first. So the system is is computerized, it
Mhm.
tends to read your understanding so fast.
Mhm.
It's like human brain.
Okay.
So if you wrong,
It
then the screen will
yeah.
shut.
Oh, really?
Yeah, because it has already concluded
If
that you don't know what you are doing. But if you get it right, by the time you are at 60% and everything is right, the screen shuts.
Oh, wow.
Because it has already determined that you know what you are doing.
So it's possible for someone to get less questions and the other
Exactly.
person will have more questions.
Exactly.
Oh, wow.
But you're not going to be graded, of course. That's NCLEX is not based on grade.
It's just pass.
Pass or fail.
Oh, okay.
So if I did 150 questions and you were lucky you did 70, in the long run, we are all the same.
So what's the passing grade? Do they have like a percentage?
You want to know.
Oh, okay.
You want to know. The computer determines it.
Oh, and then they do ask random questions from every.
So
every
they test all areas.
Mhm.
They test you maybe about the
Mhm.
infectious diseases.
Mhm.
They can test you on a geriatric, meaning older people.
Mhm.
They can test you on a pediatric.
Mhm.
They will test you on a OB, women
OBG,
OBG.
Mhm.
They test you on so many areas. They test you also on critical thinking. They will test you on
The application, like you talked
yes,
about.
so many
to apply
things.
your knowledge.
Yeah, and also they do the knowledge application whereby you need to understand the human anatomy and stuff like that.
Do they test on ethics and morals?
They do that.
Okay.
They do about, you need to know about the autonomy, all those things, and anything that has to do with ethics
And privacy and all that.
and privacy and all that. So they test you on those things, and you need to read far and wide.
Mhm.
I've had experience with some nurses telling me that, hey, when I came from Kenya, I did NCLEX and I didn't pass, and so many of them
Mhm.
will have that problem, difficulty. If you relied on Kenya, because Kenya can get you through nursing school, but it won't give you a license because you can pass a licensing test if you are cheating throughout.
Because you're in an exam room all by yourself, no phones,
Yes.
nothing. It's just you and a computer.
And not leaking.
And I think is there like
A camera?
a camera? Yeah.
There's somebody sitting there.
Oh,
I don't know every state have their own things.
Mhm.
But where I was,
Mhm.
it was a small room. They have a certain number of people who can test at the same time.
Okay.
And once you go in there, the person is right there, and you go in there with nothing.
Okay.
Like nothing, not even a pen.
Okay.
So when you get in there, it is gonna be all you.
It's you, your
And the
brain,
computer.
and your God.
In the computer.
No God. It's you,
Yeah.
yourself, and God. Okay. So what do you think are the challenges? I think I'm hearing you say. You said one challenge is if people in Kenya study to pass exams.
Mhm.
So that's one challenge. What other challenge do you think might face a Kenyan? We're talking to Kenyans
Mhm.
who has done MTC or even has become a nurse after MTC. What other challenges do you see
Mhm.
that they would face when doing NCLEX?
So the thing is, some of the things we do in Kenya theoretically, but here nurses who study in US
Mhm.
will see those things when they go for clinical. So, and I'll give you a number of examples.
Mhm.
I do some of the things I don't know, maybe. So you will correct me and bear with me if I mention something that you are familiar with and it is in Kenya. So I can talk about example. I've never seen, I've gone to some places in Kenya and I haven't seen what they call IS incentive spirometer.
Can you say that again? IS what?
Incentive spirometer.
Incentives parameter.
Yeah.
If you have it in your hospital and
Maybe there.
you're in Kenya, please comment below.
Well, it could be there. I don't
Yeah.
want to assume,
Yeah.
but let's say that thing doesn't exist
Okay.
there.
Mhm.
Then it's gonna be really hard for you. Will just be reading. You haven't really seen somebody
You don't know how it
using.
looks like.
Yeah, or maybe so many other things. My patients at night, nurses here in US, we do EKG, 12 lead EKG at night.
What is that?
It's just EKG. There is no other name I can tell you.
Oh,
It's a complete name, but EKG is not. It's
Okay.
just for measuring your rhythm.
Oh yeah.
Yeah. So
See?
so
I don't know.
EKG
Yeah.
is a longer name,
Okay.
but well,
I think I
there
know
is a
it.
complete name.
I
but
think I know it. They even have it for the brain too. Like
yeah.
for
So
the-
that one is ECG.
Oh, okay. See?
Yeah. Or EEG.
Okay.
So the EKG, need to know how to do those. So you know how to arrange all the 12 leads and where to put them.
So they will test you on those.
No, they won't test you on those, but a question can come in a certain way, testing you about the
That
knowledge
you
of
will
EKG.
need to have known and handled.
Yeah, so for you,
That
if you study
part.
that thing theoretically, it might be harder for you to say, what the hell is EKG? So, I'm just giving an example. It doesn't have to be that.
Definitely.
Yes, it doesn't have to be that. So I see so many patients when you are in the floor going through the laparoscopy surgery.
Mhm.
So, and I know what it is. I know how it's
You
done. I
handled
know, I know when the patient comes out of surgery,
Mhm.
if a patient went through a lab coli, I know what to do and I know what to assess.
And that's you as a nurse, and also if there was a nurse student here in the US,
We know those
we'll
things.
have seen them
Yes.
during clinicals.
Definitely.
Oh, okay.
So it becomes challenging in Kenya because I know lab colis are very blessed. Maybe they could be found in Nairobi or Eldoret or some big cities, but not everywhere in Kenya. You can find that because it's a newer technology. It's less invasive abdominal surgery.
Okay.
So those kind of things.
Challenges.
Yeah. So, it's not going to be an open surgery. It is a laparoscopy procedure.
Mhm.
And you will, I just gave an example. There are tons of things that we do that probably are not going to be available in the regular setting, clinical setting
In a
in Kenya.
hospital in Kenya.
Yeah.
Or a clinic.
So it's going to be challenging for you because you will need to read it harder
Mhm.
and try to really understand what it is, because it's going to be a new system. You're going to come to United States, you're going to go to patient's room, and you have all the connection in the wall. You have the blood pressure machine connected to the monitor in the wall. You have the EKG or whatever, the telemetry box,
Mhm.
and all those kind of stuff. You need to, it's going to be a new environment because probably in the real life situation in Kenya,
You
these
didn't
things
have an
aren't there.
experience. Yeah.
But you probably studied in school, but theoretically and not practically.
Mhm.
So that would be the only missing challenge,
Okay.
which I'm not going to say that people won't pass, they will pass.
Mhm.
I think the greatest challenge is the critical thinking style.
Mhm. Okay.
And that's how people fail. And I spoke to one person, and this person told me that the most challenging thing in Kenya would be passing the cardiac. I don't know, because cardiac is more, cardiac is really, really, really very
Specialized.
I wouldn't even say specialized, but in US it involves a lot of things, and there are so many cases. People coming with a congestive heart failure, people coming with a myocardial infarction, that's a cardiac arrest, and people coming with so many other health conditions.
So do you feel that that's the disease of the West more than it is for
It's
Africa?
becoming all over.
And probably someone in Kenya doesn't have more experience in that. Is that what you're saying?
So what I'm saying is, in US, the diagnosis, you go to for regular clinic, and the doctor will tell you, hey, you have a heart murmur.
Mhm.
In Kenya, you would go for the same clinic,
Mhm.
and the doctor will not catch it.
Why? Because of the machines?
Or maybe they don't pay attention to that. So once the doctor realizes that you have got probably a chronic situation, or maybe whenever you go to any clinic in US and you say, hey, they're gonna check you, and they determine immediately that they need to do the EKG to determine your cardiac rhythm. And then from there, they'll discover maybe you have what they call atrial fibrillation. Now you are at very high risk for blood loss.
Okay.
And there is no way you can be having that condition as a chronic problem, atrial fibrillation, and go home without anticoagulants like warfarin, like Alloquis, and that kind of medication, because you're gonna get stroke definitely. That is a time bomb. So in US, those things are coded. At the earliest time, in most cases, they catch it.
Okay.
Either way, they catch it. But somebody would just die in Kenya, collapse and die, and we don't know why they died.
They died.
It's because maybe somebody had a background of atrial fibrillation, but nobody got it.
Okay.
Yeah, nobody got it, and that person developed blood loss, got pulmonary embolism, or got whatever, CVA.
Okay.
Yeah.
So you think the challenge, from your experience, what you're saying is the Kenyans from Kenya, who've done, and like I said, they found the challenge to be cardiology is because of the diagnosis in Kenya.
It's because we do less for cardiac patients in Kenya. But otherwise, it's not because that we don't have cardiac issues in Kenya. We have them, but very little are addressed.
Okay.
Yes.
Okay.
Yeah, there's those cases they are there, but
so if they're not addressed, then as a nurse you don't get
then you just go
then
you just go to hospital and you don't address those cases.
Okay.
Yeah.
So how do they so with those challenges, how can someone who's watching MTC nurse, how can they help themselves go ahead, challenge that challenge?
So I would say just try to
on.
find out even from people who have done the NCLEX in the past. And again, like I said, read far and wide. Watch YouTube. There are very, very nice YouTube channels like Dr. Sarah. She doesn't call herself Dr. Sarah, but if you say Sarah Enclex.
Sarah Enclex on YouTube or online.
It's gonna pop
up. Okay.
Or maybe they call it nursing.com.
Nursing.com. And you say, I think you said nursing.com pays. You have to pay?
You maybe pay a little bit to access more stuff. Okay. But there are free videos that you can watch about cardiac, about EKG, about all those things that you really need to know before you go and do an NCLEX. Okay. And just the only that I would say for you to really pass is just learning NCLEX style of questioning.
NCLEX style of questioning. So that means preparation.
It means preparation. And go there with the mind that all questions in nursing are correct. You choose the best.
Can somebody buy books online? Is it online? Can
I think you can do online. I don't know if Amazon really ships stuff to Kenya. I doubt.
They do.
They do nowadays?
Yeah, I've seen people online talk about, I got this from Amazon. I think they do it through FedEx or something like that. I don't know, but I think they do. And if they don't, I think there are services, like company services in Kenya, who receive Amazon stuff on behalf of people. I don't know. You guys know better. You live in Kenya, so let me find out.
But if that was the case, then you can buy any NCLEX book on Amazon.
Okay. So can they buy, what do you buy? Do you buy the practice test or do you buy the study?
You can buy a book with a practice test with rationales. So when you read a question, you make a choice and then read the rationale.
So there will be books for rationale and there are books for same? It's the same? Okay.
It could be that maybe at the back where there are answers, then they give the answer and rationale. And the rationale will give you the reason why choice A was wrong, why choice B was wrong, why choice C was the best answer, and why D was the wrong answer.
Okay. Oh, wonderful.
So then that it broadens your understanding about NCLEX questions.
That's wonderful. So the reason we are talking about nurses coming here, why are there opportunities? To tell us, are there opportunities for nurses?
I don't know how a nurse is paid in Kenya. I think, if I'm not wrong, you guys can correct me because you could be doing better, right? Yeah. But I know they get paid maybe even some are 20,000, some are 30,000, some are 40, 50, to maybe 100 the highest, maybe in big cities like Nairobi. Okay. Now, 100,000.
$1,000.
That's $1,000. That a nurse can make in a week.
In America?
Yes. So, and if you want to see, because somebody can say, hey, how about the living standard? Yeah, still you're gonna make money as a nurse.
No matter what.
You're gonna make money.
So tell me, Zeph, what's the current pay? Can you tell my viewers or our viewers how much can a nurse make here? Like a range. Give us a range.
So generally, because every city is different, you can go to California, you're gonna get up to $70 an hour. You other states would be average. I would say for a registered nurse is about $30 an hour.
Okay, so a registered nurse is you who went to FTC. Is a registered nurse.
Yes.
Right?
Yes.
Has a diploma.
A diploma,
FTC,
yes.
Yeah, has a diploma. So you're looking at $30 an hour to 70, 75?
I would say depending on where you live. Yeah. And now here is what makes a difference even. Okay. If you are traveling nurse, then you're not gonna be like any regular nurse.
Oh, what is a travel nurse?
Travel nurse is a nurse that signs up a contract with who does contracting. You do contracts only. Okay.
So you're not employed by
you are not employed by a hospital, or you are employed by an agency to work with a certain hospital. Okay. And that is why then I'm in Arizona. I'm in Arizona for
contract.
Yeah. My 3 months ends in Arizona. And I came here from Texas. Okay. And I'm probably gonna move to another state, travel around.
So how much, so what kind of money are you looking for? Are you looking at? So contract nursing. I know you said
right now for contracting nursing is about $4,000 in a week.
$4,000 in a week is,
I would say it's about, call it, okay, let's say.
Between, just give us a range, an hour.
I'm gonna tell you the least at the moment that is offered on the market is about.
Did you say $4,000 a week?
Yeah, so let's go. That's near the average. I would say the least. Let me talk about the least.
Hold on, let's post that.
I wanted to give you the minimum first. So the minimum, which can give us a good picture at the moment, is about $3,000 a week. And those
$3,000 a week, 300,000 Kenyan shillings A week.
Yes, and those are only working 3 days.
3 days. How many hours? 12 hours.
12. That's
So
correct.
36 hours a week. You make almost 500,000 Kenyan shillings. So that's why we're having this conversation, to tell you guys there's opportunities.
So yeah, so if you did that for a month, so the first week if you are living extravagant, like we were having that conversation.
Let's not even go there.
So if you are living extravagant,
Yeah.
your weekly pay, your first week can pay your rent and other things. Even though we're talking about that, you get all those allowances for per diem, if you are a travel nurse. But like I said earlier, it's so difficult to put all nurses
in one basket.
One basket, because it depends on your specialty. If you're an emergency room nurse,
is that the one that pays more too, or?
Yeah, ED also pays more.
Okay.
ICU pays more. Med-surg more. Cardiac pays more. PCU pays more. PCU is a progressive care unit, where from ICU to PCU to med-surg.
Okay.
So that is how you can be also working in what they call CCU, which is a critical cardiac care unit.
Okay.
Which is,
so they pay more too.
Yeah. So it depends on the specialty.
Okay.
You could be, maybe you like to do a laid back job. You're still a nurse, but you're the one what they call home care nurse. Home care nurse is people who are discharged from the hospital. They decide to take assignment because this patient went home with a wound after surgery. You want to prevent any infection. So you visit this patient maybe once a week or twice a week to do the dressing change.
Okay.
And maybe went home with a PIC line. PIC line is like that IV PIC line that is central line.
Okay.
You're gonna go and help change the dressing for that and do the infusion. So that's more like a laid back job. Some people prefer that, not everybody.
But they don't pay as much as.
They don't pay as much.
Okay.
So it depends on what you want to do. And if you really want a more laid back that deals only with chronic illnesses, work in a nursing home. In nursing home, you only deal with these old patients who have what they call a long-time care. They have chronic problems, and that's all you do. They are not sick; they are there as home, but you have managed their medication and their care.
So, do you think somebody watching me who is probably graduated from MTC or is a nurse in Kenya, can they come and become a travel nurse right away?
No.
Why?
Zero.
Why?
Because you need to put down one experience.
How many years?
Because even if you have worked in a med-surg for 1 year, it's gonna, even if you went to school in US and work in med-surg for 1 year, it's gonna be challenging for you to get a travel job.
So you need how much experience?
They need usually need 2 years.
2 years of nursing.
Yeah, and
in the US, can the Kenyan experience count?
No.
Okay, so you have to come.
You're gonna freak out if they send you and you just came from Kenya and then put you on acute care.
Yeah.
And start as a travel.
It's too much.
What you gonna do?
No.
Okay, you have knowledge, yes.
Yeah.
But you won't be able to handle that pressure in the first place.
Okay. So what's the best transition then from somebody watching and they want to come here?
So
where do they start?
So when you just first arrive here, the reason first as to why they require like 2 years experience in the flow
is what?
Is because when you sign up a contract, maybe you decide to work in a big hospital, trauma hospital, they train you only for 1 day.
What?
Training is only 1 day. The second day you are on your own. Wow. At most 2 days. But so the first day, okay, the first day is training on the computer. So you don't see the patients.
So just knowing the system,
knowing the system, telling you here, these are the protocols, and it's gonna be really a busy, super crazy day. The second day is now when you are doing what we call a preceptorship. So you work with another nurse on the floor, showing you where to get stuff, how to access the pixies, doing this and this, doing this and this. And then the third day, you're on your own. You have your patients. And they don't say, oh, because it was your first day, then the care standard will be lower. No.
They still hold you to the same standard.
They hold you to the same standard.
But do you have a supervisor, somebody you can call and ask? Or
one great thing with nursing
is
if you get stuck somewhere, you call for help.
And somebody
don't do things that you don't know because you're gonna kill somebody.
Yeah, but also you don't want to be like.
If you don't know anything, let's say, okay, the doctor has ordered medication that needs to be titrated. And these are very critical medications. Maybe people work in cardiac will understand. Maybe the doctor has just ordered medication that needs to be titrated with the blood pressure or with the heart rate.
Okay.
So the doctor will put orders, and then the orders will clarify, say, hey, titrate this medication every 5 milligrams, maybe in every, to achieve the heart rate of 80.
Okay.
So if the heart rate was maybe 150, so you keep monitoring using telemetry, monitoring the heart rate, and you keep titrating the medication.
Okay.
Yeah, so if the medication has been ordered and you don't know what to do, you need to know the limits of those medications, where you cannot go below or where you cannot above.
Okay.
And then, so what will happen is that you need to, if you don't know the medication, it's always a best practice to just say to somebody, hey, I've never given this medication. How do I do? Those kind of things.
Okay.
Yes.
So the best transition, first of all, you can be a travel nurse when you come. So what's the best, like where can the person start when they're coming?
So when you just arrive here, I would encourage you to, if your goal is to go to that crazy high speed kind of where
The goal is to make money. How about that?
you want to travel, right?
Yeah.
So I would say start with med-surg.
Message, okay.
Yeah, medical surgical unit. But if you really want to gain extensive experience, see if you can get ICU, which is so complicated. Nobody wants to hire you in ICU for training because they are tedious problems. You can do cardiac because cardiac is more intense. You're gonna be dealing with cardiac drips, which are also a very high intensive medication, and that expands your knowledge. If you begin to travel and work in PCU or med-surg, you will feel so easy. You can handle any kind of pressure or anything.
Okay.
Yeah.
Okay.
And the reason why challenging is some of the nursing is kind of different than Kenya is because nurses who work in med-surg, they manage so many medications, they manage heparin drips, they manage so many medications that are potentially very high risk medication that can kill the patient if they are not controlled well.
So thank you so much. So for someone who is watching in Kenya, where they are right now, so preparation of NCLEX, but if they have the opportunity, they're working, what kind of exposure should they expose themselves that will make it easy for them here, easier? So what should they do? What areas?
If you are really nervous and you don't know what you're gonna do, start in the nursing home because those are chronic, long-term patients.
No,
So-
now I'm talking about someone in Kenya. What can they do now?
In Kenya,
Yeah, to expose themselves to what is going to be once they come here. So maybe work with cardiac. It sounds like you're saying cardiac.
but I don't know because I've never been to any
Okay.
cardiac unit in
Okay.
Kenya. I've never been to. I don't know what the nurses literally do on their own, like within their scope of practice. Because here a doctor cannot order. You cannot find a doctor putting a pick line himself. I mean, they do what they can do, but mostly they are done by nurses who are trained to do that. Right? So let's say IV. I'm not saying that the doctor cannot start it, but that is entirely nurse's responsibility.
Okay.
The doctor will only put an order that, hey, in any admission, there are those automatic orders to start the IV, to do this and this and that and that and that.
Okay.
But let's say start the Foley, put a catheter on a patient. So the doctor will not come and do that. That's your responsibility. And the order is just there. You need to know what to do and how to do it. And the thing is, unless the patient really, but you need to do all those things like when you insert a Foley and it doesn't go because maybe the patient has what we call a BPH, they call a prostatic hyperplasia, and like benign prostatic hyperplasia. So then maybe you look for another one called a Coude, which is more stronger and go through the prostate. If you can succeed, then you need to notify the doctor. Then the doctor, maybe the urologist will come and insert it himself.
Okay.
Those are only exceptional situations. So I don't know the intensity of different units in Kenya, that can give you really equivalent to.
Yeah, or put you in a footing. Okay.
Yeah, maybe there are some places in Nairobi.
Okay. Okay.
I believe so, because I've never been there.
I guess we'll just leave it at that. Yeah.
Yes, but if there is when you come here, it's gonna be completely different.
So would you encourage somebody who just graduated from MTC to start studying for NCLEX and come over here?
That would be the most important thing, because even if you were to look for a place in Kenya to give you experience,
it's not
that experience will not help you. It's more than likely it will not help you here. Yes, I know you know how to do a blood transfusion, but every hospital in US is different even when you are doing a blood transfusion.
Okay.
Maybe the only thing that is common everywhere is that you check the blood pressure beginning and stay with the
temperature
stay with the patient. No, check the vitals.
The vitals,
at the beginning and
stay with the patient.
Stay with the patient 15 minutes. And check the vitals again 15 minutes into transfusion. Maybe that one is standardized.
So universal kind of.
It's kind of universal.
Okay.
But there are other things that every hospital requires. Documentation is different in every place.
Okay. So you heard it from the horse's mouth. If you just graduated from MTC, don't wait to get experience because that experience might not be helpful. So Siogope, go ahead and study for the NCLEX and YouTube, internet.
Maybe the experience that you will get in Kenya is only dealing with the patient.
The hardship dealing with the patient. And it might be different. I think in the previous video, there's a video done. He talked about how they deal with patients here. So that would be even different in Kenya, probably, like these procedurals that you have to do here. Like before you get mad, how you greet the patient.
How you educate the patient about everything, because you don't just give the medication, you need to tell the patient what they are taking. And we didn't even mention it because, with the treatment in US, let's say the doctor wants to give a surgery. Before they do that, they are supposed to explain to the patient the alternative.
So the patient
then we say, okay, the first route would be doing this. These are the risks. We may not succeed much here. Here is another one. These are the risks and these are the benefits. Here is another route. These are the risks, these are the benefits. And then give the patient chance
to decide.
And the patient can say, I have to talk to my family. We respect that very much. The doctor will say, okay, thank you so much for your time. I will go. And what time would you think that I can come so I can get a feedback? And then the patient will say, I'm going to call my husband. And as soon as I get talk to him about it,
then we'll let you know.
And they respect that. That is why you really like America. And that is a lot of respect there. So the patient will call the family, talk to the family, and maybe they make decision quick. And then they put a call, like they call the nurse and say, hey, the doctor was here. I think we have made a decision. We're going to go for the procedure. Would you mind calling the doctor for us? Then we call the doctor back to the room. So you need to learn, when you come here, you learn the culture of
how they do things.
How things are done. You respect the patient, you explain to the patient what you want to do, and the patient make decision. They have that, what we call autonomy, which is in the part of the ethics. Yes.
Oh, okay, wonderful, thank you. So is there anything else?
So finally, if you don't have money, this is how I like saying this, money should never hold you from doing anything.
So don't say,
if money was a breakthrough, I wouldn't be here. I never had that. So anyway, I don't even want to say because it's a longer story. But what I believe is people really shouldn't lie to you that they didn't do anything because they didn't have money. Because I've seen people without money doing it.
So don't make money for NCLEX be a barrier, because where there is a will, there is a way.
There is a way. And I was telling you about this man that I read his story about when I first arrived in US some years back. So this man is called I'm sorry because this thing is making noise and I didn't want it to make noise.
So an inspiration to you, a book that you read?
Yes.
About a person?
It's called Leginson. And this man, he was 16 years old. It's called Nyasada land in Malawi. 1958, he was 16 years old. His dad had died. And he was like, he was reading small articles about America. He read about Lincoln. And he was like, this
Abraham Lincoln.
And he was like, my dream is to go to America and free myself from poverty. How is Leginson gonna leave Malawi? 1958, when everywhere was just like forest.
We didn't even have TV. I think TVs were invented in the 50s.
Talking about TV in the village?
No, I'm just saying there were no TVs.
There was nothing at all. Not even the radio.
Really?
He was barefooted. He had only, the clothes he had is what he had on. But he knew that the travel, because the book says, if you can find that book, read it.
What is the title?
It's called I Will Try It.
I Will Try It.
And on a small letters, it says, a man who traveled from Africa to the United States, Fairport. So this man took off and the family didn't know where he was going. He was just claiming that he's going to America.
So he didn't tell
And it
his
was
family?
like a dream.
So he didn't tell his family?
The man didn't know.
Oh, okay.
So all of a sudden he took off, left, and he went all the way by foot.
How did he know where America was?
I don't know even how
Like
he was
where is
reading.
west and where is east?
So he went through Tanzania, crossed the Tanzania, entire Tanzania.
Looking for America.
And I can tell you for sure, I've taken a bus from Dar es Salaam to Dodoma.
Where is Dodoma?
Dodoma is the border of Zimbabwe, Zambia,
Mhm.
and Tanzania.
Okay.
It takes about
24 hours?
over than 12 hours, and non-stop.
There's a bus
A
that
bus,
goes that
and
far?
it's going really far, high speed, non-stop for over 12 hours.
Wow.
So now you are crossing Tanzania by
Like foods from Malawi.
from Malawi.
Oh, wow. Because
All
he
the
wanted-
way,
Did he know
He
his
just,
geography really?
I guess
Like
he
there was
knew a little
sea
bit,
or something
and
like
maybe asking, and he took all with animals on the road and everything during those days,
that?
1950s, and he went all the way to Tanzania, Uganda. From Uganda, he stayed there. He took off from Uganda all the way to Khartoum, Sudan, by foot.
Wow. There must have been good Samaritans feeding him.
Yeah.
Probably he must have been a good communicator.
If you read the book, you will
You
know.
know?
more.
Okay. I've never read
But,
it. Yeah.
but what happened is that after he was in Khartoum,
Mhm.
he was still finding his way
To America.
to America.
Yeah.
In Khartoum, he met some missionaries.
Mhm.
Talked to the missionaries, and the missionaries was very devastated about this.
So he told them
The
the
story.
dream that I'm
The dream.
trying to go to
And now
America,
his
the land of
dad
Lincoln.
died. After his dad died, he decided that he was going to change life by going to America.
So did the missionaries help him? Or how
The
did he?
missionaries helped him
And then what happened?
look for school
Mhm.
and went to Seattle, Washington. Yes,
So he
he studied.
achieved the dream.
He achieved the dream.
Mm.
So just imagine from dust to somewhere. And here somebody is complaining about money, but Levinson didn't even see that as a problem. And some of us didn't even see that. And people who knows us, who know our history, can attest to that and say, hey, it is not money, it's the will.
Yeah.
So don't keep begging people and say, help me. You can help yourself.
And don't give up just because you had the cost and you see that it's so humongous, I can't do this.
Yes.
I think people would say, saying I don't have money is like a complete sentence with a period, with a full stop. I think it's better to say I don't have money right now. There's a comma,
Then at
but
least you
I'm
haven't seen it.
looking for it. Yeah.
Yeah.
So when there's a way, there's a will.
There's a way.
Yeah.
And don't ever have
When
like,
there's a will, there's a
I
way,
can't,
so.
I can't.
Mhm.
That thing builds up in your mind and is the worst thing ever
Mhm.
to possess in your life.
Mhm.
Whenever you're just thinking about, oh, I can't,
Yeah.
it builds in you.
Mhm.
But if you say, I will,
Mhm.
I know I can do it, then you can surely do it.
And he's here talking, just because he said some things are difficult doesn't mean that it's not possible.
Yes.
So he was just saying, what challenges you're going to go through.
Yes.
So I think sometimes, Zeph, for me, my experience with people in Kenya, my brothers, my sisters, everybody, I love you, but I feel like they always want a hand, like somebody to hold their hand.
Somebody
Like,
will help.
oh, this idea, it's like you've given them information and then they still want you to to complete,
Yes.
to do the work. And here in America, nobody
Nobody.
will help you. We are here not because I'm here personally. I couldn't tell him say just states.
I'm
Nobody.
telling you.
I was received by international student advisor at the airport,
No, that's all.
that's all, and it's like I did the application all by myself. And sometimes, like, I remember somebody asked me, it's like, oh, how do I come to America? I want to go to school. And I had made a video on the process of, coming here on an F1 student. I sent the person the link. I'm like, okay, watch this video and let me know if you have additional questions, because I've made a video, follow the steps and all that. I'll disappear. It's the culture of hold my hand.
Yes.
Yeah.
And you need to learn how to live on your own.
Mhm.
Whether you are just eating a biscuit and sleep, that's all you got, and you got to survive that way until you get something.
Until it
better.
gets better, yeah.
Yeah.
So I really like that advice, Kwamba. If you heard this and you're like, oh my God, that's going to be a lot of money. Where will I get money to go to South Africa? Where will I get money to go to India? I think you do what you have. You start where you are with what you have.
And,
right
I,
now.
and I can tell you,
Mhm.
do you know when you owe somebody money in Kenya, how it takes? I mean, if somebody, let me put it this way.
Mhm.
So I took off from Nairobi going to South Africa by bus.
Oh,
It took a
really?
week.
Wow.
The drive was a week on a bus. So I had only 3,000 from,
2,000 shillings.
yes, from Nairobi.
Wow.
And somebody made a promise that he was going to send me money.
Once you get to South Africa.
No,
Mm.
once I'm in Tanzania. Just imagine trusting a Kenyan to send you money in Tanzania and you don't have money to even bring you back from Tanzania if it fails.
And you went ahead.
And I went ahead, I took a bus from Nairobi to Dar es Salaam.
Did they send you the money, sir?
He don't even talk about it. But I got the money, he sent me money.
Okay.
But I had a lot of
Faith.
I had faith that he was going to do that. And for sure I got that money because this, if he said no, I don't know what would have happened. And all my 3,000 has gone to the bus from Nairobi to Dar es Salaam. Anyway, let's end it there.
Yeah, I know. And if you're out there, also I wanted to say this. I think a lot of people and a lot of parents probably are taking their students to college. Wanasema, oh, mtoto amepita, wacha hapo university. Ukisikia tu mtoto hapo wapi? University. They're not even considering, what course is this kid taking? So if you're out there and look at university, you're taking public health or maybe business administration, Mimi, I'll just tell you this. I think at this point, prepare your life for global market.
Yes. Do what
the global market wants.
Yes.
So as a Kamoko second year saizi,
strategize.
Start. If you start applying for MTC. Aki nurses are needed, like since I came to this country and I've been here for a while. They always need nurses. They're always bringing them from the Philippines, from everywhere. So if I were you, probably somebody who's doing public health is someone who likes sciences and all that. Public health in Kenya is not.
It's useless.
Yeah,
it's not
going to help you.
And
so,
I don't know which country I am public health
officer.
Really.
Yeah, I'm like, stop.
I mean, they can hire even in US, but the different specialty altogether. Maybe you have master's degree going up there, then you can work with the state to improve the healthcare system. But they don't pay well.
But you can do that later.
Yeah.
Come do that later if that is your passion, public health. Start because you like, obviously public health, you have passed biology, whatever. So I would say if you get an opportunity, apply next year to go to MTC and wachana tu Astoria University.
Yeah, the name title.
Wachana tunayo. Business administration, nothing, it will not do anything for you in the global market as it is right now. So just quit, and I think MTC is 40,000 shillings a year. And if you go, what is it called? That is the traditional program. The other one I think is 100,000 a year. No. MTC, they have like the traditional ones, the intake are traditional. And they have private intake. I think that's what they call.
Oh, I see.
Yeah, so it's 40,000 a year, I think 100,000. So that's my message to you. I think we've really message.
Yes.
We'll stop here. Thank you so much for listening. I'd like to know your comments about what we talked about. Please subscribe to my YouTube channel, like this video.
Look for Zeph too.
Look for Zeph. Yeah, Zeph is gonna post in this platform.
You can follow me as well.
Yeah, follow Zeph, and we'll continue discussing this. Please let me know in the comments below what topics you want to know, so we can keep discussing. And what else did I want to say? I think that's it for today, guys. Thank you so much for joining us. I will see you again next time. Look for me at 2 Year Studios on YouTube. Thank you.
All right.
2 Year Studios.